The biggest project that we took on in those first few years was what they call a longitudinal study, a long-term study of gay men who would be sampled over several years, hopefully. And given interviews and questionnaires as to their sexual behaviors or other risk-taking behaviors, so that we could follow the actual behavioral patterns of gay men, whether they were testing negative or testing positive, and over time sort of find out what happened to them, or get a better sense of what were the riskiest activities, what were the activities that were maybe not at highest risk, and then once some people tested positive, what were the kinds of options that were most helpful to people, and what could we do to help to assure people that when we were referring them to care, we wouldn't be exposing them to discrimination by referring them to insensitive caregivers. So going back to some of those tools that we created at the Seattle Gay Clinic, like that network of gay-sensitive physicians, we were able to show the CDC that if you had a community that had enough, a certain degree of mutual trust, and a high degree of involvement of gay providers and staff members in the program, you could do it. And we actually enrolled more people in that study than any other city was able to enroll in similar studies, and followed them over 9 years. I think we had over 2,800 people by the end of that 9 years. So that was one piece of the work that we